Well, my name's Carol, and about 5 years ago, I went in to have my eye removed, and it was supposed to be an easy surgery that would last about an hour and a half. And sometime after they put me to sleep, I woke up to hearing disco music and somebody screaming, "Dig harder, dig deeper." And all I could think was, I'm awake. And I tried to move, and I couldn't move, and I couldn't scream. And then I felt like lighter, some sort of ignition fluid was just going through my veins. And I thought, have I been wrong about my life? Maybe I'm in hell. I never really got a full answer as to what happened during the surgery, but I can tell you that I had to have 2 additional surgeries after that. Can you imagine the fear of having to have another surgery after that happened with you the first time? I have PTSD, and I take medication for that and probably will for the rest of my life. Well, you can only imagine. It's terrifying to go to the doctor now. It's just
So about 2 years ago, me and my family experienced a horrible tragedy. My wife at the time was 16 weeks into her pregnancy, and she began going into labor. We ended up going down to the hospital, and she gave birth to 2 twins prematurely. Immediately, they had been rushed to the ICU. Thought everything would be okay. The doctors explained that they'd be able to have this handled. Apparently, though, that the nurse taking care of them at the time, she was supposed to give 100 units of heparin, a routine thing to flush the IV catheters to my children. She ended up grabbing the wrong vial of adult heparin and giving over 1,000 times the prescribed amount of heparin to my children. They ended up both dying because of the complications that happened. Obviously, protocols and regulations weren't followed, and I don't necessarily blame the nurse. The nurse was a mistake that was made. It turned out that the pharmacy company had been printing these labels to these heparin vials that looked really similar to these new ones they developed and were shipping out to all these hospitals, but no recall had ever been done to try to fix this mistake of 2 different vials of completely different dosages looking very similar. And so I think it was just wasn't necessarily her fault alone. It was a whole fault in the system that regulations weren't being followed. Me and my wife have actually started an organization to try to bring awareness to all these mistakes happening, because it turned out that at that same hospital, my children weren't the only children that died from this type of mistake. There was 3 other children that also died from the same type of mistake of these misprinted vials that hadn't been recalled because they're looking similar. So I think it's a big mistake that, it happened not only just in this hospital, hospitals all across the country, and I think we're trying to really bring awareness to that things need to be changed. There need to be more protocols and regulations really locking down this type of thing, because mistakes like this shouldn't be happening. I think the future will be better. I think there's a lot of doctors on board, a lot of medical staff, and directors at the hospitals. They're all working together to try to really bring a change in the healthcare and really lock down these new regulations and protocols and things that nurses and staff can do to really try to watch out for mistakes like this, so this doesn't happen, this type of tragedy doesn't happen to other families like it did in mine.
My story started 2 years ago when I was diagnosed with bone cancer in my right arm. The doctors decided that amputation was needed. So when I woke up from surgery, I realized that they had amputated the wrong arm, and they still needed to go back and remove the right arm. And it left me with this. Before any kind of medical procedure or operation, you need to mark the site that needs to be operated on. And you also need to mark the site that does not need to be operated on. If they're going to operate on your right side, you need to mark the left side.
About 6 months ago, I was having some stomach pains and decided to go to the hospital to get it checked out. And it turns out I had appendicitis, so they performed surgery and everything seemed to go well, and I was discharged and went home. Well, a couple of days later, I was sitting on my couch, somebody knocked on the door, and I jumped up real fast to go answer it, and a pair of scissors shot through my stomach. It was the most horrible pain I've ever felt in my life. It was definitely a 10 out of 10. They found a pair of scissors, a sponge, a surgical sponge, a piece of gum, and somebody's name badge in my stomach. I pray they find the person that left that stuff in my stomach. My advice for other people going in for surgery is to do research on the surgeon or facility they'll be using and to check their track record for any other errors that might have happened in the past.
This could have been avoided if they had the right things in place. Like, I just don't understand. I just really, she was only 17. Like, I just miss her so much.
After surgery, her surgeon completely took responsibility for what happened, which, I mean, that's great and all, but it wasn't entirely his fault. And so there were deeper issues going on there, and the proper things were in place to secure the right blood type, which you would think would be a vital part in organ transplantation, but apparently it wasn't. Their systems weren't highly reliable. Well, the doctors didn't have the right things in place to go about screening for blood types, and Jessica had type A and the donor had type O, and they implanted organs, a heart and a lung from a patient with type O, and her body, of course, rejected it. They found their error quickly, though, and replaced it with new organs that were her blood type, but it was too late. Jessica ended up away. But one good thing did come out of this. They have systems in place now to prevent this type of thing, and I just pray to God this never happens to anyone else or anyone else's family, because it tore my family apart. I mean, Jessica's only 17. She has a whole life ahead of her. And then something like this.
First off, I would advise everyone to take someone with you and make sure that you are not alone in your care system. The answer is speak up. We have standards. The medical community must embrace the implementation of evidence-based system and process improvements to mitigate safety vulnerabilities. We know what standards hospitals should be adopting. As a consumer, ask your hospital if they are using standards that can make your care safe. As an industry, we have developed many safe practice methods in response to these types of errors, such as the Safe Surgery Checklist. By using checklists, we ensure the accuracy of many aspects of procedures, such as confirming correct med and dosage, site of procedure, and accounting for all instruments and material used. For an example, it is common practice now to account every surgical sponge before and after a procedure. A task as simple as this can save lives by preventing devastating infections from forming post-surgery. In 2008, the Joint Commission identified risk reduction strategies aimed to improving the safety of medication for all pediatric patients. The recommendations included that all medications be standardized and identified effectively with a process for drug administration. Administration time should be standardized to prevent errors. The number and concentration and dose strengths of high alert medication like digoxin, insulin, and heparin be kept to a minimum. Organ transplantation, because it is highly complex, often stresses the systems and processes of care and therefore offers a unique opportunity to proactively identify vulnerabilities and potential failures. Today, there is a standardized process for organ procurement and transplant network policy. They require the transplanting surgeon at the transplant center receiving an organ offer to assure the medical suitability of the donor organ for transplantation, including ABO and subtype compatibility. Recurring news on wrong organs being removed and wrong site surgery are evidence of avoidable medical mistakes. Performing surgery at an incorrect site has devastating outcomes. Standardized markings of surgical sites are recommended. It is critical that the markings be waterproof, that they be clear and visible once the patient is dressed. The most common type of medication error in neonatal instances involves incorrect dose, accounting for 37% of errors. 14% is contributed to administration of the wrong drug, and 20% comes from the omission of the drug completely, and the remainder is caused by the wrong administration technique. Awareness is an event where a patient is very explicitly called to surgery. It occurs when there is a disproportion between the depth of anesthesia and the stimulation to the patient. How can we avoid the problem? The National Patient Safety Agency and the American Society of Anesthesiologists recommend undertaking a thorough review of the patient's medical history and tailoring anesthesia for the specific patient, checking the equipment for every case, and reducing drug error by checking the correct drug and dose has been drawn, and constant monitoring of the patient's vitals. Never leave an unconscious patient alone.